and it makes it difficult for them to make rational decisions about their health and well-being. So once dependence becomes an addiction, they're no longer in control of their brain, essentially. So welcome to the Mad Forensic Scientist. Be sure to smash that subscribe button. And now, the opioids. As part of the body's natural relief system, and the opioids bind to these same receptors. They block the transmissions of pain and produce feelings of euphoria and relaxation. Problem is, these opioids are much better at binding to the receptors than our own endorphins. So there's three types of opioid receptors in the body: the mu, the delta, and the kappa. Each of these are located in different parts of the brain and the body. Specifically, the mu opioid receptors is the primary target of opioids. Opioids, prescription opioids, illicit opioids, they like to target the mu opioid receptor. And this receptor is responsible for producing feelings of pain relief and euphoria. This receptor is also located in the parts of the brain involved in reward and motivation, as well as the spinal cord and the peripheral nervous system. But the reward system is what's important, as the opioids can activate the brain's reward system as well, producing feelings of pleasure and motivation. So when these opioids bind to the mu receptor, they activate the VTA, which is the ventral tegmental area of the brain, which stimulates the release of dopamine. And dopamine is a neurotransmitter that is associated with pleasure. So as you know, you get quick dopamine release. As you get dopamine, you're going to want that more. So because opioids trigger in the pain response, they also release dopamine at the same time, and it's a vicious cycle of reward for the pain relief, which leads to dependence. So over repeated exposure to opioids can lead to changes in the brain's reward system, making it more difficult for a person to experience pleasure from natural rewards like food, sex, or social interaction. This contributes to the cycle of addiction, as individuals may continue to use opioids in order to avoid negative emotions and the physical symptoms associated with withdrawals. So as the person becomes more and more addicted, more and more dependent on the opioids, that's when addiction happens. So opioids affect multiple areas of the brain that's involved with decision making, impulse control, and emotional regulation. This chronic opioid abuse can impair these cognitive and emotional processes, making it more difficult for the individuals to control their drug use. And it makes it difficult for them to make rational decisions about their health and well-being. So once dependence becomes an addiction, they're no longer in control of their brain, essentially. So the pathways have become so tolerant, so immune to this, that if you actually remove the drug itself, the body has trouble regulating pain. So any touch, anything just starts to hurt. So they have an oversensitivity, and they have this pain. So drop in serotonin, drop in dopamine, so they're very depressed. Their body's just in withdrawal, and just everything hurts. Everything's annoying, and that is so hard to overcome. And it just gets to the point where taking opioids is no longer about the pleasure. It's no longer about feeling pain relief per se. It's just about trying to reach normalcy. So once they become tolerant, once it becomes an addiction, then it's just to the point where just to maintain normal levels in the brain, they have to take the drug. Which of course then starts to lead to overdose. As you become more tolerant, as you need more and more of the drug, then you take more and more of the drug, and this can lead to a serious and life-threatening complication of opioid overdose. So this happens when you take too much or in combination of other drugs or alcohol, especially benzodiazepines and alcohol. This can cause respiratory depression to the point where it either causes brain damage or death if not treated properly. So Narcan, naloxone will help reverse an overdose of these opioids that help release it. But honestly, taking Narcan or Suboxone will actually initiate withdrawal. We'll get into withdrawal in another lecture, another time, maybe actually in the shorts. So keep an eye out for shorts. I'm gonna have a little more details in the shorts as the opioid crisis in a nutshell. Appreciate you guys watching. As always, I hope you guys enjoyed it. Check out the community page. We do have a community page on YouTube. Check that out. Be sure to check out the shorts. The shorts have a lot of good information. So subscribe. That's the biggest thing, is click that subscribe button. Do it. 1,000 subscribers. That's all it is for me to run a half marathon. 1,000 subscribers. That's nothing. Come on. You guys can help me out. For the boys.